As hospitalizations of Mainers with COVID-19 creep upward once again, work is being done to help those who have had symptoms for weeks, months, even years. Good evening, I'm Pat Callahan.
And I'm Amanda Hill. Maine's Center for Disease Control says as of this morning, 193 people with COVID are getting inpatient care. That's not far from a 3-month high of 231 hospitalizations, but still short of the all-time high of 436 during the height of the Omicron surge in mid-January. While the current COVID strains out there are spreading more easily, they don't seem to be as severe.
Some people barely even realize they've been infected. Then there are those who came down with the virus months ago who just haven't been able to shake it. They're called long COVID patients. The U.S. CDC estimates that 5 to 30% of patients with the virus still have symptoms at least 4 weeks after treatment. Researchers from Maine Medical Center's Research Institute are recruiting patients for a national study to try to find out why this is happening and which patients are at the greatest risk. Meanwhile, some clinical trials on a potential treatment are expected to get underway in Maine later this summer. News Center Maine's Vivian Lee has our update.
More than 2 years since the first wave of COVID-19 swept the country, researchers still have more questions than answers.
We don't know whether the different variants are more or less likely once they infect an individual to cause long COVID.
Dr. Cliff Rosen is the director for the Center for Clinical and Translational Research at the Maine Medical Center Research Institute. He's one of the principal investigators of a more than $500 million study funded by the National Institutes of Health called Researching COVID to Enhance Recovery or Recover Initiative. Now, Maine is one of 80 sites in 30 states participating in the study, and scientists are recruiting patients who have had COVID-19 and recovered to people who have never had the virus to patients who have long-lasting symptoms. Another concern, a recent study found vaccines lowered the risk for long COVID by only 15%. Dr. Gary Gibbons is the director of the NIH's National Heart, Lung, and Blood Institute. He says the goal is to uncover why some people have symptoms after initial infection. Lingering symptoms, federal studies show, continue to affect between 7 to 23 million people across the U.S.
Shortness of breath, loss of smell or taste, sleeping disturbances.
Doctors also want to know why long COVID also affects a wide range of patients, from those who initially had severe symptoms to others who were asymptomatic.
Every time I go, they're diagnosing me with something new.
Cynthia Hamilton has suffered from sudden rashes, severe fatigue, shortness of breath, and debilitating pain after coming down with the virus 2 years ago. She has tried everything from brain-based therapies for her neurological symptoms to medications, but her condition continues to decline. Now her sons Ryan and Eric are struggling with brain fog after mild cases of COVID several months ago. She plans to participate in the Recover study.
Why some of us are getting such, horrific symptoms would be awesome.
Answers could be revealed from a clinical study that could start in August on the effectiveness of a supplement derived from a plant. Dr. Rosen, though, is not disclosing its name at this time.
If it works, if people feel better, we can get them supplies for free, basically.
Participants will complete surveys, blood work, and possible follow-up testing. Vivian Lee, News Center, Maine.
You can get more information on how to enroll in the Recover Initiative on our website and mobile app.